any person who appears before us has to take an oath or an affirmation. I would like to direct the clerk to guide the nominee on taking of oath or affirmation.
I, Dr. Solomon Kibet Sirma, do swear that the information that I will give to this commission is the truth and nothing but the truth. So help me God.
Honorable members, I would like to confirm that Dr. Solomon Kibet Sirma has taken an oath, and as such, we may engage him now. Honorable members, before you is the nominee for position of CEC for health. Let me get the correct position for health services. And he's Dr. Solomon Kibet Sirma. Can you tell us which name are you comfortable with? So, which name should we use for the purpose of this interview?
I'm used to Sirma.
Okay. Okay, for the purpose of this interview, we'll refer you to Dr. Sirma.
Yeah.
Dr. Sirma, you'll have 60 minutes engagement with these members. Please help us to manage that time. This is the Committee of Appointment for Baringo County Assembly, which draws its mandate from the Constitution of Kenya, Section 7 of the Public Appointments, County Assemblies Approvals Act number 5 of 2017, and Standing Orders 190 of Baringo County Assembly. This committee is chaired by myself in my capacity as the Speaker, and I'll invite the members here to do self-introduction. There are 11 members with us here. Let me start with my immediate left.
Yes, good afternoon, Dr.
Good afternoon to you.
Yeah, my name is Honorable Kibruto Kimosop, MCA Mochongoi Ward, a member of this Appointments Committee, and also the Deputy Speaker, Baringo County Assembly. Thank you.
Good afternoon.
Good afternoon.
My name is Honorable Lawi Kipchumba Talam, MCA Lembus Queen, the Majority Leader of Baringo County Assembly, and also a member to this committee. Welcome.
Thank you.
Good afternoon, Dr.
Good afternoon to you.
I am Lokoria Josephat, member of County Assembly Baruesa and Deputy Majority Leader.
Thank you.
Good afternoon,
Good
Dr.
afternoon.
I'm Honorable Veneline Jerov, nominated MCA Baringo County and a member of this committee. Welcome.
Thank you.
Good afternoon, Dr. Sirma.
Good afternoon to you.
I am Paul Olgisoi, MCA Mugutani Ward, a member of this committee. Thank you. Welcome.
Thank you.
Good afternoon, Dr.
Good afternoon to you.
My name is Max Yalo, MCA Mogoti Ward, and a member of this committee. You're welcome.
Asante.
Thank you, Chair. Dr. Sirma, my name is Mailuk Shedrak, MCA Tangube Korosi Ward, member of this committee.
Thank you.
Habari daktari.
Good afternoon.
Naitwa Jane Jerob, nominated MCA, representing the person living with disability. Thank you.
Thank you.
Thank you, Chair. Good afternoon.
Good afternoon.
My name is Ayub Kibet, MCA OLL Chap Chap Ward, and a member of this committee.
Thank you.
Thank you, Chair. Good afternoon, Dr.
Good afternoon to you.
My name is Ernest Kibet, MCA Kabarnet, Majority Whip, and member of this committee.
Thank you.
Good afternoon, sir.
Good afternoon to you.
I'm Daniel Tuwit, Doreria, MCA Ripco Ward, minority leader, and a member of this committee. Welcome.
Thank you.
Daktari, with us here also is our clerk, who will introduce herself and the members of staff present.
Thank you, Chair. My name is Winnie Chemasa, the clerk of County Assembly of Baringo. We have the staff with us. We have the deputy clerk, James Warata. We have Zipporah Koroti, the head of Hansard. She's the editor. We have Emma Kemei, the head of ICT. We have Henry Tekeiwa, head of research. We have Madam Lulu Chochoi, the head of human resource. We have Hilda Kiprono, office administration or administrative. We have Tuikong Kiprotich, head of communication. We have Tobole Locorio, the Sergeant at Arms. My farthest right, we have Sharon Serem, Hansard reporter. Thank you. Thank you, Chair.
Daktari, we now know all of us.
Yes, sir.
When we placed the advertisement in the newspaper, we requested you to come with the original documents. Do you have them with you?
Yes, I have them with me.
Kindly hand it over to Mr. Tobole, our Sergeant at Arms. You will return them to you after this session. Daktari, do you have a valid KRA tax compliance?
Tax compliance?
Yes.
Yeah.
You will have to respond because it's recorded in the answer. Do you have a valid Kenya Revenue Authority tax compliance?
Yes, I do have a KRA compliance certificate.
Yes, also be addressing the chairman whenever you're answering questions. Do you have a valid higher education loans board clearance?
Yes, sir. I do have a higher education laws board clearance.
Do you have a valid ethics and anti-corruption commission? Ethics and anti-corruption commission clearance?
Yes, I do have EACC clearance form.
Do you have a valid certificate of good conduct?
Yes, I do have a certificate of good conduct.
Do you have a valid clearance from a reputable credit reference bureau?
Yes, I do have a CRB clearance.
Thank you. We shall go through the same and we'll seek clarification if need be.
Okay, sure.
Have you been charged and convicted in a court of law?
No, I've never.
Are you a dual citizen?
No, I'm one Kenyan citizen only.
Okay. Daktari, members of this committee will ask you questions.
Yes, sir.
You will be expected to answer the questions through the chair, And since the members know that they will also ask the questions through the chair,
Okay, acknowledge, sir.
you will be expected to be precise and to the point when answering questions.
Point taken, sir.
You will also be expected to be honest in answering all questions. And for the honorable members,
Fine, sir.
as a tradition, you are expected to declare conflict of interest as per Section 12 of the Public Officer Ethics Act 2012. Dr. When we placed their notice in the newspapers,
Yes, Chair.
we requested for members of public to raise objections and memoranda or affidavits if need be. And I wish to confirm to you that we did not receive any for your case, and as such we'll proceed on that basis.
Thank you, sir.
Dr. When you came to the county assembly, we gave you a form to fill, a questionnaire.
Yes, sir.
I would like to take you through that questionnaire.
Yes, Chair.
And one of the things that I noted, your sources of income.
Yes, sir.
You mentioned salary and
Yeah.
farming.
Yes.
Can you
Yes,
tell us
sir.
how much is your salary?
Okay, salary cumulatively per year I get around 4 million. It may vary upwards slightly because of annual increment.
I want, if you can break down for us to monthly income.
The other income?
Monthly salary.
Gross will be, although it's over 350.
Over 350, thank you. You also talked about farming.
Yes, sir.
You have not told us what you are farming. You know, in Kenya, we have supporters of another party, which I don't know what's the name of that other party, that has been advocating for planting of some other crops. So we want to know which crop have you been planting, or which animals have you been rearing?
You see, that is cumulatively together with the size of the farm.
So it's farming, which kind of farming are you in?
I do maize and cattle.
Okay.
Dairy farming.
Thank you. Let's go to your net worth.
The?
Net worth. Your
Net
wealth.
worth.
Yes. Your wealth.
Or my net?
Net worth.
I'd written there it's around 24,700,000.
Can you give us a breakdown?
That is farming is around 20.
Sorry?
No, I don't think it is. You see, why I mentioned, I was, you need that is the wealth declaration I usually do every year. I thought we meant the wealth declaration.
Number 25, there's a statement of your financial net worth. And you told us about a family farm worth 20 million.
Yes, yeah.
Where is this farm, and do you have any documents to support the same?
I don't have it with me, the documents right now, or the title deed.
What's the size of the farm, and where is it?
It's around between 32 acres.
And where is this farm?
It is at Majimazuri Mumberes ward.
Machimasuri Mumperes ward.
Yeah.
Your other wealth?
That one now, it was the salary, the one I mentioned.
Yes.
And I have 2 cars. One is worth around 400,000, and the other one is worth around 300,000.
Okay. Thank you. I'll ask you also, perhaps you can tell us about yourself, Daktari. You have 4 minutes to briefly tell us about yourself.
Come again, sir.
You have 4 minutes to tell us about yourself.
Oh, thank you, sir. So, Chair, I'm Dr. Solomon Kibet Sirma. I am a medical doctor and I'm a specialist in obstetrics and gynecology. And I was born on the 11th of October 1967. I'm fifth born in a family. And I should make this one also known that I was the first one to be born in an hospital, Eldama Ravine Hospital. I started my primary school at Kabimoi Primary School, 1980 to 74, did my CPE. Thereafter, I went to Lenana High School, 1981 to 84 for all levels. Thereafter, I went to Litain High School for my sixth form, Form 5, Form 6, 85, 86. Then I remained a little bit at home. And then I was lucky to get a scholarship to go and study medicine in Italy. And by the way, I did medicine in Italian language. And I'm fluent in Italian. I graduated after 6 years. Thereafter, I came to do internship at Kenyatta National Hospital from 1997 to 98. After completion, I was posted to Moi Teaching and Referral Hospital to work as a medical officer. I worked for 2 years. Thereafter, I joined the University of Nairobi under Kenyatta National Hospital to do my master's in obstetrics and gynecology. After completion of my master's in 2007, I was posted to Kapsabet District Hospital as the medical superintendent and as a specialist in obstetrics and gynecology, and I was given additional duties to be the then director of medical services within Nandi County, where I was there for 2 years. Thereafter, I was posted to PGH Nakuru as a specialist, and I was the head of the Department of Obstetrics and Gynecology, where I worked for 4 years. Thereafter, the devolution came, and they required directors, chief officers, CECs, so I applied to be the director. So I was a director of medical services for Nakuru County for 5 years, until the year 2019. Thereafter, an opportunity came that they wanted chief officer. I did apply, and I've been the chief officer medical services in Nakuru County to date, and on a contract which is expiring next year in March. That is my position now.
Thank you, Daktari. You have an impressive career. Are you a member of any professional body?
Yes, Chair. I am a member of Kenya Medical Association.
Yeah.
And I'm a member of Kenya Obstetrics and Gynecological Society.
Okay. Thank you. Okay. Congratulations, Daktari. Let me give to my colleague to ask you some few questions. We'll take questions from Honorable Kimosop and Honorable Olkisoi.
Daktari, first of all, congratulations for your nominations. And the position in question is CEC. I have listened to your impressive background. What makes you think that you are suitable for this position of CEC? Okay. You, just curiosity, your contract as a chief officer will expire in March next year. If we confirm you as a CEC, you are expected to resume, to commence work here immediately. What happens to that? You terminate the other contract, or we wait for you to finish the other contract, then come and take up this position?
I think where I am currently, I think I'm satisfied at the level where I am. And actually, I am a PNP, permanent pensionable in Nakuru County as the director. I was only seconded as the chief officer. And the salary that I was earning is the salary of a director, because the salary of a chief officer is lower than the directors because of being value as a medic, because the other allowances. So in public service, an officer, when he moves to another job, cannot be disadvantaged. If you're earning more than what you are going to be given, then you retain the same. So what will happen here now is, now I'm around 55 years. So once I am lucky to be given an opportunity to work in Baringo County as a CEC, I'll just take early retirement under the 50-year rule. And I'll come and work as the CEC.
No, I think I'm satisfied. I think, Chair, so what I get from you is there would be no delay.
Yeah, there is no delay.
Like you would assume the responsibility immediately.
Exactly.
Yeah. Now tell me your experience as a chief officer. The chief officer, in my understanding, is the accounting officer of the department. You must have obviously worked with a CEC, and you must have worked in a county environment where you are oversighted by the assembly. What is your experience? What was your experience engaging the assembly committee? Did you ever appear before the Nakuru County Assembly Committee at any time? And if so, on what accounts? What were the issues? Your reports at any time? Generally, just to understand the environment around which you worked as a chief officer, at the executive level, and the relationship with the assembly, because that would still be the same environment here.
Yeah, yes, Chair. I think being the chief officer, many times we interacted with members of the County Assembly of Nakuru for various reasons. I know one of them was about the human resource. Another one was about delay in projects implementation. The other one was about strikes within the department. And we had a very cordial relationship with members of the County Assembly of Nakuru, because whenever they called us, we were able to explain any of those audit queries they were asking, or any clarification pertaining to what they are presenting to us. So I should say we worked well.
So you worked well. At no time you were censored. At no time you were summoned or anything.
There was no censoring. It was only we were summoned for clarification.
Yeah, but at no time did any censor come up?
No.
Okay, thank you. Then finally, Chairman, on my part, is I don't know what to call it, whether to call double loyalty or a blessing on our end, because we are having worked in Nakuru County, and you have an experience of Nakuru County. Now we are talking about Baringo County, and a practical question on my end. The biggest challenge we have, of course, here is the health sector and the health system. What, in your view, comparatively, when you compare the situation we are in, the situation Nakuru is in, and the kind of proposals that you have to make Baringo health system function better than it is now?
Thank you, Chair. What I should say, how we worked in Nakuru is actually, I can call it, is not rocket science. It's the normal things that are meant to be done. And when you're addressing the issues of health, we have pillars that we need to address. One is the human resource. The other one is health financing. The other one is health infrastructure, leadership and governance. The other one is service delivery. The other one is M&E, monitoring and evaluation. So when you address the issue of leadership and governance, you have to have an organogram. From the governor, there is a CEC, the chief officer, we have the directors, and we have something called the CHMTs, that is County Health Management Team. Actually, those are the backbones of health, of which it is not well structured in Baringo County. That is what I realized.
You will realize, Daktari, or I inform you, maybe, I don't know whether you have the information, that our biggest crisis is lack of medicine in our facilities. Yes. Actually, that is the biggest headache that we have. What would be your comment on that? How would you help us to fix that so that we don't have shortage of drugs in our facilities?
The issue of health products and commodities is very important in terms of service delivery. Because what we did in Nakuru is that we prioritize drugs. And we sourced from the cheapest suppliers. And we are using KEMSA. There is another supplier called Mission of Essential Drugs and Services, which are cheap. And once in a while, we only went to these other private suppliers or the local suppliers, if there was need. And we allocated enough money for health products and commodities in Nakuru. And for the 5 years that we were there was no outcry of stockouts. And we also see loopholes where there are pilferages, because we have in every sub-county a county pharmacist who gives data and he shares with us every month. Of course, we are not fully automated as we would have wished, but we picked honest healthcare workers. Of course, there'll be few rotten ones here and there, but we managed to stop them from taking away the drugs for our patients.
So, Chairman, Daktari, so I take it as a commitment to you, I mean, from you and to this committee and to the people of Baringo, that with Dr. Sirma at the helm, the issue of drugs as a crisis will be adequately addressed and will be a thing of the past.
I will say yes, okay, but we shall need a lot of support from the county assembly members.
Okay. Thank you, Chairman. Those are my questions.
Honorable Kisoi. There's a follow-up question by Honorable Lawi. Now you may ask the question, then Lord Kisoi.
Thank you, Chair, for allowing me that time. I've heard Daktari say we used to allocate good amount of money to the health sector. And I know Nakuru County gets a bigger share resource envelope from the national compared to Baringo.
Exactly.
I'm lucky to have served as a budget chair during the other regime, and I'm still the budget chair, a budget member, sorry. How much was allocated to the health department? I've seen the budget chair looking at me. How much was always allocated to the Department of Health in terms of medicine, in terms of O&M, and in terms of salaries? And how was the wage bill behaving? Because here in Baringo we have a problem with the wage bill, that it is even more than development. Thank you.
Okay.
Daktari, let's wait for all the questions, then you'll answer all of them.
Maybe, Chairman, just on that line, Daktari, just like, we know Nakuru County has a bigger cake, but just on like a dispensary, we know we have dispensaries in Nakuru also. So can you try to show us how much was the likely budgetary allocation for a dispensary for that is a level 2, maybe what do you call the level 3, that is the health centers, and maybe the level 4s, so that the issue of money we get to know, because we also know what we've been doing in Baringo, but maybe you tell us how much money, as the chief officer, you've been budgeting for such infrastructure.
Thank you, Chairman. Daktari, I've seen your impressive performance in primary, that you was CPE, clean A's. I've seen you've gone to your master's level. I've seen that you have worked, you have an experience working with Moi, Rivaro, teaching at Rivaro Hospital. You have been to Nairobi, you have been to Nakuru. And coming to Baringo County, given that you have been nominated and if approved, you will serve in this county for the period that you will get your contract. You realize we have challenges in the medical field or in the health sector. We have spread of hepatitis B, Sandai area, Laikipia area, Mugutani area, it's increasing. You have cancer level going up. You have challenges in this place, or employees, medical practitioners, few. We have challenges in Baringo of insecurity and all that. In your journey of academic progression and in your journey also on the experiences you have, how do you draw your relevance to this post that you are being nominated to? That if appointed, how do you draw your relevance to that post to Baringo County? Second, your highest level, how will it serve this county? Thank you.
Okay, thank you, Chair. I would like to start with the question of the majority leader, Honorable Lawi. What I should say, I can say a lot of things. Allocations for all counties are never enough. They are never enough. When you look at Nakuru County, they get, health alone get around 7 billion allocation. But I can say 65 and above to 70, between 65 and 70 goes to salaries of staff. And so when you check what's going to remain, will be for recurrent and development, which is not always enough. First of all, I want to give you a small brief of what a partner did for us in Nakuru County in terms of health products and commodities. They did something called forecasting of and quantifications. Exactly what do we require every year, so that we can say we have enough. And they went ahead. When they gave us a report, they told us for Nakuru to say we have enough, we require every financial year around 1.3 billion for drugs. And what we managed, no, it's 2 billion, sorry. It's 2 billion. And what we usually allocate for commodities, health products and technology, that is what we call it, is 800 million every year in Nakuru County. And how we allocate monies to the level 1, no, level 2 and 3 and 4, we use what we call a workload of that facility. And everybody has something called a drawing rights. If you are seeing our drawing rights will depend on the workload of that facility. If you see more patients, you get more for drugs. If you see less patients, you get less. Now, when we come to, that is for levels 2 and 3. When we come to level 4, these are now facilities who collect money called F5. And after devolution, we did a legislation of an F5 bill where we ring fence funds that are collected in this level 4. And in Nakuru County, we have around 15 level 4s. So we have what we call a low volume and a high volume. So in terms of volumes, the low volumes, of course, will get less allocation for drugs. And the high volume will get the equivalent of their workload. For level 5, it's a bit different because level 5 gets what is called conditional grant. That is a former Provincial General Hospital. It was given conditional grant to cushion them because they are referral hospital for 8 counties, that Baringo included. So for them, they have sufficient. Apart from, they still collect F5, and it is plowed back to the facility to improve the facility. And on top of that, even our wage bill, although I'm sure it will be legal if it is well scrutinized, that same monies, the F5, is used to employ, to engage healthcare workers, the technical ones, like nurses, lab technicians, even doctors. So if we were to count the wage bill, it will arrive at around 70 plus. But that one is hidden somewhere. Through the chair, our MCA from Mukutania, hepatitis B you mentioned. Hepatitis B is an infectious disease. An infectious disease, some of them you only need to prevent by vaccination. And their vaccination, they are vaccines for hepatitis B. And they are given free of charge because we are supplied by the Global Fund. It is only that you need to request. Like in Nakuru County, at least we vaccinated all healthcare workers with hepatitis B. Cancer, it's true, it's on the rise. And it is among our 6 health objectives We call them policy objectives, 6 of them. We call them NCDs. And what we are doing, we want to halt and reverse the rising cases of NCDs. Cancer being one of them, hypertension, diabetes. And we have high-impact interventions to deal with cancer. I don't think you've gone very far. Like Nakuru County, we have screening, routine screening of cervical cancer, which is a major killer in women in this country. Prostate cancer. And we've opened a cancer center in Nakuru. It is very well advanced. Until recently, we even have a radiotherapy unit. So cancer can be treated like cervical cancer. It will be curable in some few years to come. Because how you treat cancer, you have drugs, we call them chemotherapy. We have surgery, and we have radiotherapy. In Baringo County, we can start by a chemotherapy center. And then for those who need irradiation, can be booked in Nakuru. We can start in 2 sub-counties, like Kabarnet and Eldama Ravine. And there are also cancers like cervical cancer that are routinely screened, and we should make them routine. There is also a vaccine that has been integrated into the National Immunization Program for young girls called HPV, human papilloma virus that can cause cervical cancer. That we are doing a lot of sensitization, we are doing a lot of campaign, and we're also doing vaccination. We can start, and there are cancers that have not advanced. We have equipments that can treat cancer at the early stages, especially for cervical cancer. And those equipments in Nakuru we have in all our health centers, which are around 34, and all the major hospitals. And there are donors who are ready also to donate those equipments with the reagents. And they are within us. If they know there is a friendly CEC who will come to Baringo, they might follow me. As I said earlier, through the chair, Excellency from Kuchani, about the relevance of my position, I think I had explained earlier, I'm a medic by profession, and I understand the system well. So I think I'll be relevant in that position. I know where to press the button. Asante.
Thank you, Daktari. Let me take 2 sets of questions from Honorable Ernest Kibet, MCA Kabarnet Ward, and Honorable Josephat Lokorio, MCA Barwesa Ward.
Thank you, Chairman. Daktari, welcome. Daktari, I know you've had the privilege to work in Nakuru County, but you are the son of the soil. We can equally say that you've had the privilege to also be peeping to see what's happening in Baringo, and especially when you were given when the governor saw it that you get nominated. Can you tell us, because you must have had a sneak preview of what's happening in Baringo, because we expect you to work from day one. So I am imagining that you already have seen. So my question would be, describe some of the tools of intervention that have been developed to enhance health service in Baringo County. What you've seen that is in existence for now. Another question, you are a product of a political situation. I am the majority whip, UDA party. And that is the Kenya Kwanza coalition. And we have a manifesto. Your governor who nominated you has his own manifesto. And it is all in line with the Kenya Kwanza manifesto. How do you intend to apply them in order to improve health services in Baringo? How will you bring to life our manifesto as far as health is concerned? The third question, how will you align the national government policies on health with the county health goals within the legal framework? Thank you, Doctor.
Dr. Sirma.
Yes, sir.
You are ready to take my questions?
Yes, I'm ready.
Now, before the questions, I have two concerns that we've just raised and I was impressed. Number one, that would be very good to share with this committee is an aspect that you mentioned of automated services. I don't know how you would really initiate this program so that we will be able to have drugs in health facilities on time and dispense them on time and minimize this culture where Madaktari steals drugs. And number two, you mentioned something on drawing rights. How practical are you imagining that it would work in Baringo? Now, I just know that then my questions are, Daktari, there's been a lot of challenges, and I'm speaking to you as the Chair Health Committee. We have experienced a lot of challenges in Baringo that requires some rapid measures so that we mitigate. What do you think we can do? As simple as that. What mitigation measures can you help the people of Baringo handle these challenges relating to health for a long time in Baringo? And number two, there has been a lot of referrals in Baringo County. I don't know whether you experienced the same in Nakuru. Tell us how you would go ahead and minimize the referrals so that we're able to save our people from such kind of referrals. My last question, Daktari. There was a COVID-19 pandemic in the recent past in Baringo and Kenya and in the world. How do you intend to deal with such calamities going forward? Vis-a-vis the prudent management of allocated funds in Baringo County. Thank you, Chair.
Doctor, you may answer those questions.
Okay, thank you. Thank you, through the chair, for the question asked by Honorable Member from Kabarnet, of which he was asking me mainly about the challenges of Baringo County in terms of health, whether I've seen them. Yeah, I may not know all of them, but what I know about the challenges is more of service delivery. There are referrals. There is a problem in management of ambulance services in this county, because I remember I was somewhere in Nairobi and there was an ambulance that was going to Nakuru and is stalled on the way because of lack of fuel. So there should be good management in terms of the ambulance's fleet, of which an important department like health should have its own transport officer to take care of servicing and fueling and repairs of the ambulances. Another challenge that I saw was about the structure of the governance of the health sector, of which I had mentioned earlier on, where we have the CHMT members, the County Health Management Team, and the programs officers, and those who are in charge of the sub-counties, because I'm told some of them don't have the relevant qualification, or they kind of try and supervise people who are more senior than them, which I think it does not go well with the healthcare workers. The other one, if I may remember, was about the manifesto, the governor's manifesto. I've read it, and he wants to increase the number of level 4s and equip them in order to give quality services at the highest attainable service of health in this county. We also need to do trainings for healthcare workers, of which we can do training in two ways. We can do something called on-job training, or we have regular continuous medical education, and that must be a must in all facilities to update them on the current situation of management of health conditions in this county. The other one, if I got it well, about aligning the national and the county legal framework. As you know, the national government does policies. They set standards and they give guidelines. That is their role. At the county level, we do the implementation. But the most unfortunate thing is that we do more functions, but it is not followed by resources. So we are still lobbying at the COG if resources can follow functions. And it is at certain level. Unless I didn't get, maybe, that is what I picked from your question, Honorable Sir, through the chair. The honorable member from Saimo, Barwesa. What I can say, automation, we have already started, like in Nakuru. We have 7 facilities where we've done automation, called EMR, electronic medical records. We have done automation for revenue collection, and to a small extent for dispensing of drugs. Where I can say we have really succeeded is automation of revenue in the level 4 hospital. I can promise you their revenue is cashless. You don't give out money. You send money direct to the bank. Na mkutane huko kwa benki. That is how we have avoided these pilferages or stealing of money. So, and they bank 100%. You collect 100 shillings, you will find 100 shillings in the bank. That is where we have succeeded. It is cashless. There was the issue you also mentioned about the drawing right. The drawing rights actually means it is the cash, it's the money. That is the drugs that we are sending to an A facility is 2 million. To B facility is 3 million. Those are the drawing rights, depending, as I had said, about the workload of that facility. You mentioned about mitigation.
Maybe through Chair, Dr. The automation that I was talking about is not necessarily the revenue itself only. But I'm looking at how would you ensure that drugs that come to the Baringo County, Riverol Hospital, for example, which is a dispensary at Koloa, and that officer receiving a pharmacist or a nurse would be able to receive, say, 10 packets of Panadol. And that officer would be able to account through dispensing. Do you have an idea that we can initiate such kind of thought here in Baringo so that we are able to gap that serious problem of stealing? And on drawing rights, I am sharing with you because I have some experience from here. That a nurse in Temura, for example, dispensary, orders for drugs worth, say, 1 million. But at account level, where these drugs are now given back to the nurse, they are given 100,000. Now, how are you going to handle this? Because this has been the headache in the county.
Okay, let me explain to you. When we are distributing drugs to a facility, there's usually a committee called the Receiving and Acceptance Committee, and they should not be less than 2 people. They should be 3 people. And there's something they sign that they've received. And then you see what Baringo, they've been having a problem about supervision. I don't know the last time they did supervision in health facilities. You know, we have the sub-county health management team who are supposed to do supervision on a monthly basis in all their facilities and give us a report. That is about everything: the number of patients that were seen, the drugs that were dispensed, if there will be any death. There are monthly reports. I'm sure you know about that. And which was the other one? I wanted to answer it. Sorry, I think it has gone out of my mind.
No, they were just automation. If you can introduce going forward.
Okay. No, now, the issue of automation about the drugs, there is an infrastructure for it, and there are different companies. And I've had an experience of getting quotations in Nakuru County. It's not cheap. They are quoting me not less than 300 million. To put up an infrastructure for automation for dispensing only drugs. So that's why we are doing it in phases in Nakuru County. We can still do it here by the major level 4 hospital, the sub-counties. You can start with Kabarnet and Ravine, for example. and we go in phases. About the mitigation measures you talked about, it is a matter of understanding where challenges is by looking at the 6 pillars that I had mentioned earlier to identify where is that problem is so that you can solve it. Where is the problem in human resource, health financing, health products and technology, governance and leadership, so that we can address each thematic area and see how we can improve of where they are not doing well. Referrals, you mentioned about the referrals. You know, Baringo County have not adopted something called a referral strategy, where you need to move patients and the reasons why. Because unless otherwise, you are supposed, when you are referring a patient, you are supposed to call the facility that you are referring to, whether they will accept it or not. Simple things like cesarean section should never be referred from this county. Things like blood transfusion, you should not be referred to another facility for transfusion. Because I know those are the major referrals that has been happening. Because you see, a level 4 hospital, at any one given time, should have a minimum of 10 pints of blood at any given time, and that is a must. For Kabarnet, should have around 20. I know there's been a challenge in terms of blood, but something is being done. What we did, we went a step ahead in Nakuru County. We facilitated blood campaigns for our facilities using the regional blood transfusion centers, and I'm sure they also serve here. You just buy them fuel and lunch. You collect the blood, but it is screened and the regional transfusion centers. We can either take it to Nakuru or Eldoret. If there are 20 pints, of course, some might, of course, not all of them will be okay. Some will be contaminated. But if 15 are good, we'll bring back the 15 to our county and distribute them within the facilities. Unless it's a major operation, then that can be handled in that facility. Then we can accept referrals. And then also, we need to redistribute the specialists that are here, because there is no need of putting a gynecologist in Chemalingot and he's alone in case of an emergency. He will not be able to handle because there is no blood. We'll rather refer that patient to either Marigat or Kabarnet using an ambulance. And another issue, what we did in Nakuru County is about the medical officers. At the sub-county level, we appointed people called sub-county team leads who are not doctors. Doctors should go to the hospitals and operate on patients and do the ward rounds. Si kutembea kwa dispensaries and health centers, they are not assisting. It would be rather a nurse or a clinical officer. They'll be useful at that level. I've mentioned, you mentioned about the COVID. COVID was an infectious disease, just like even cholera. So what we do there, we do something called contingency plan. How do you handle an outbreak like that? You do a contingency plan where you form committees committees of coordination and leadership. You form a committee of case management. You isolate, you create an isolation center. You have to sit down and do a budget for lab reagents, for drugs, for fluids, and of course, the issue of prevention and promotion, where we'll have the surveillance, we'll have the epidemiologist, we have the lab, we have the CHVs, which are very key in this area, at the community level, to do sensitization, to distribute posters and brochures to the community, to see how they can prevent themselves. Because the aim actually is to avoid spread of this disease and the deaths that may cause. Those are the contingency measures that needs to be put in place. And of course, you mentioned about the funding. Of course, there will be a budget for that. And there should be a committee who are in charge of funding, because everything is budgeted for. And we should also have regular meetings to review the budget. What was bought and where did it go? And are they of good quality? Some people may even supply here. So that committee will need to answer that. And another thing that I think Baringo never did, which was very, very important, was to put up an oxygen plant. Because during COVID, oxygen was actually a very big essential drug. And it was not going to be used only during COVID times. It will be used for other patients, like premature babies, like in theaters, like in ICUs, you'll need oxygen. Instead of buying, because the oxygen plant just harvests oxygen from the air at no cost. It's only the plant, and we are well to go. Thank you.
Maybe last one, Chair. Dr. Baringo people are following you live. Maybe it would be very nice if you can share with us the number of health facilities that are in Baringo. And maybe you can put them in categories of dispensaries, health centers, sub-county hospitals, or those levels. Kindly.
I got a brief. The community units in Baringo, they might not be active, but functional, they are around 170, but they need around 180. The dispensaries, I know of 180, but somebody told me they are around 200 because there are 35 that are not operational currently. The health centers are around 30 something. And then the real level 4, where I can call them high volume, are only 2. The rest are low volume, and they actually even don't qualify to be called level 4. That is Marigat, Mogotio, and Chemalingot. They don't qualify. They need to be upgraded to be real level 4.
Thank you, Jay.
Daktari, your last comment
Chair.
has shocked me in the sense that we have always thought for a long time that we have 6 level 4 hospitals in Baringo, and I'm shocked and I'm also happy because we have a person who has diagnosed the problem and is now going to provide the solution. Baringo will be watching you and will be looking up to you to provide a solution. That we have a referral hospital, which has been said to be not only a referral hospital, but it's also referring patients again. We have a referral hospital referring patients. Most of the time, it's like all it does is receive the patient, then refer the patient to another hospital. And I'm happy that you have been able to analyze the issue and said most of those cases are cesarean section and those who require blood transfusion. And you have given us a solution for the same. Dr. a challenge to you now is, this committee here will be watching you. They'll be following you, and the chair of health, Honorable Lokorio, will be following your case closely. And as such, we would like you to commit yourself before this committee that at the end of these 4 years, or at the end of these 5 years, we should be having the 6 functional level 4 hospitals in Baringo, and you also ensure that there are 5 dispensaries that are not functional, either closed or they are meant to be operational. And so that I don't take my time, let me give to Honorable Mailuk to ask. And that should be the final question, unless there are members who have.
Okay, thank you, Chair. Dr. Sirma, concerning the question that, the issue that the Chair has raised concerning the dispensaries that currently that are not operational currently. Let's say that this committee approves your nomination to be the CEC of Health Services. How will you work to ensure that these non-operational dispensaries are operational within the shortest time possible? Then again, Dr. Sirma, you have worked in Nakuru County, and automatically you have been in contact with the County Assembly of Nakuru. The County Assembly has a mandate of oversight, representation, and legislation. Take an example that you have been summoned by the Committee of Health Services of County Assembly of Baringo to respond to questions on impact of drought and famine on the children, on the health of children in Equichatis area, that is in Tiati sub-county. You have 3 minutes to respond, 2 minutes to prepare, 3 minutes to respond, and 2 minutes for questions and answers. That's practical. You are being summoned, and this is the Committee of Health Services, concerning the drought and famine, the effect of drought and famine on the health of children in Equichatis. Kindly take the stage and respond to the Committee of Health Services. Thank you.
Then I'll start with that one about the impact of drought. As we know, Baringo is among the 23 ESL counties that have been affected by the drought. Of course, it's a very serious issue, and it has a lot of impact in terms of health, because there is scarcity of water, there is scarcity of food. The scarcity of water, there are a lot of waterborne diseases. So we need to move very fast to see that we have adequate water, because children will be affected. The issue of food is also very crucial, because what we'll expect that from the drought will have lack of food will be malnutrition. And once a child is malnourished, is prone to all kinds of infections, because the immunity goes low in most cases. So we should work very fast with the Department of Agriculture, the donors, to assist us in the supply of foods, and of course to work with the Department of Water in terms of water provisions, and of course edible water, not just any water, because this is a multitask issue. it will not only be health. We need to collaborate with all the relevant departments. That is water, agriculture, Ministry of Education, and so forth. Going back to the non-operationalized 35 facilities, it has not only happened in Nakuru County. We have the same number also in Nakuru County. And the challenge is the cost of operationalization of these facilities. You know, there is a cost of operationalizing a dispensary. We need an healthcare worker. We need drugs. We need money for operation and maintenance. And what is happening now is that NIDA has been assisting us for only the gazetted facilities. That is where they send the money. So it will be up to the county to allocate some more monies. And I hope I'll not be offending anybody, because there was a study that was done by a consortium, both Nakuru and Baringo, and they said we don't require any additional health facilities. We expand what we have and we renovate, because we've made the threshold, the WHO threshold of a facility within every 5 kilometers. We have achieved that. Eh? Yeah, that is a report we got.
Honorable Mailuk and Honorable Olkisoi, you kindly, you respond through the chair. Honorable Mailuk, Honorable Sirma, sorry, Dr. Sirma.
Yes, sir.
You're protected, proceed.
So that is what the recommendation we had been given some times back. I think it's around 4 years ago. But as I've told you, there is a cost of operationalization of those facilities. If the funding is there, it can be even operationalized tomorrow. We'll need, as I've told you, healthcare workers to work there. We need money for operation and maintenance, and we need allocation of drugs. Then we'll be happy to go. That is only what has been hindering. And Honorable Lawi had mentioned about the wage bill eating above the ceiling. We should also take into consideration that. Thank you.
Honorable Olkiso and Honorable Mailuk, once the nominee will be through with this session, I would request that you can share one table, take tea or coffee, then you share your experiences about the same. I can see we have 3. Let's start with Honorable Kimosop, then we go to Honorable Lawi, then Honorable Sialo. Those should be the last.
I think, Daktari, I share the feelings, the outbursts that was seen from Lolkisoi and Mailuk. And I think I would still want to get good clarification on this report. Whose report was this report that came out? Because maybe for your knowledge, as you come to serve Baringo, if you go through, some of us come from very fast, extremely fast wards. New settlement scheme in my case, which still require a lot of development. And so such reports should not be backed on stopping further construction, but there should be a formula on population, a formula on distance, as you put it, and a formula on practically on the patients and the patient rate in a particular facility. But I think it's important so that, because this is an interview on record, unanswered, and it's always good to clarify that if there's such a report, it's good to know where it came from, and somehow it also receives the reservations that we have about it.
Honorable Kibruta Kimosop, you'll also join that table. Daktari, you will just you'll just inform the member what's the kind of report, and when you'll be taking the two together, you'll be able to answer the details of the question of the report. Honorable Lawi.
Thank you, Speaker. Dr. Sirma, having served as a CEO, Health Nakuru, you must have interacted with the budget. And you've seen how money has always been slashed from the source. Money meant for the hire of equipment. To a tune in Baringo have been slashed about, we have been giving out to national government around 90 million to 170 million. And actually, when you scrutinize these referrals, most of them are due to the equipment we lack in some facilities. Like for Ravine, most of the time we lack CT scan, and that's why at times people are being referred to Eldoret, to Nakuru, to Kabarnet. So what is your thinking on this money used for hire of equipment? Secondly, you've told us that you studied in Italy, and I wish we would have talked to this meeting using Italian language. But since we don't understand, given that chance as the CEC Health Baringo, will you even still have a chance to go there with the relationship, having studied there and lobby for equipment to this county of ours, Baringo, even if it means the second-hand equipment? Thank you very much.
Honorable Sialo.
Thank you, Mr. Chair. Dr. Sirma, I've heard you mention so many challenges facing our health sector in Baringo and in the country at large. Now, here in Baringo, there's this CBA that you guys have it with the government. And most of our medical officers, as we speak, are on study leave. And from our experience here, when some of them come back from the study, after finishing that probation period, they leave working for Baringo County and look for a greener pasture elsewhere. And as such, we have a few number of officers working for government as a result of that. So how will you handle that issue? Number two, there is also this misconduct by medical officers. You will find most of them have their private clinics within the county. And at times, instead of being in the hospital, county hospital, referral hospital, offering services, they abscond duty to attend to their own patients at their own private facilities. And or even look for locums elsewhere, like in Eldoret, while they are supposed to be in service. So I would want to know how you will address such challenges. Thank you, Mr. Chair.
Thank you, Chair. As Chair, some concerns to share. I just want to share with him, Dr.
Yes.
I want to find out if nominated or approved for this nomination. We have a lot of directorates in the hospital, in our facilities. I mean, at the county level, some medical staff have redesigned some duties and redesignated themselves to be titles that are not existing. How long, maybe you can share with us, how long you would take to transfer all these people and put them in wards and theaters and all those things? And because that is a very serious matter, I know we will share with you later. And number two, is actually, let me share with you that one. Thank you, Chair. At personal, no, maybe Daktari, it's about these MOs. And specialists. How possible would it be that we have routine kind of visits by these doctors in those small units down there, Akwijatis, Makutani, specialists to visit Wananchi and listen to them to reduce referrals? How possible would that be? Yeah.
Okay.
Proceed and answer.
Thank you. Honorable member from Mochongoi. This report, what was this report that was being headed by Nyachai just after devolution? That is a committee. I don't know what it was called.
Chairman, so you were referring to a national kind of a discussion?
Yes.
Not specifically Baringo?
No, it was national.
Oh, that was, you scared us.
No.
No, that's okay. If we are talking
of those few, the other counties also.
Yeah, no problem.
No.
Yeah, so I thought there was a report specifically on Baringo.
It was the whole country. It was a recommendation for the whole country. Okay, the other one was about, I think I'm through the chair. Now I come to Honorable Lawi. I know there was something called MES, Medical Equipment Services, where equipments were bought for at least two facilities per county in the whole republic, and some they had a third one. And I know there was no consultation. There was an MOU signed. It was, I don't want to mention a word. And according to my experience, we also had the same. But I should say that this undertaking was very expensive. Although there was backup systems in terms of servicing, but it was very expensive. Imagine like in Nakuru County, before the money reaches the county, 200 million had been already cut. Because if we could have used, because this program went for 7 years, what would we have done with 1.4 billion in 7 years? We would have done a lot. We'd have bought even other equipment for other facilities because they were targeting only two facilities. If we had 1.4 billion, I'm sure we'd have equipped more than 10 health facilities. We didn't get value for our money. That is my comment. From where I studied my undergraduate, I think lobbying for assistance will still be possible. There are so many volunteers who want to come, but they only need a contact person. They can even put up a theater, and they can do what we are doing here called outreaches. When they are on their holidays, the complex cases, they can come and operate free of charge. That one, I know it will be possible. Honorable Sialo from Mogotio. The study leave, it is a problem for all counties. Because I saw here in Baringo you have 76 medical officers on study leave, and you are paying their salaries. In Nakuru County we have 56. We are paying their salaries, and they are not working for us. So we had an engagement with national government that they take over the training of these medical officers. We had reached a stage. They take over the 76, and the salaries for 76, we can engage other medical officers. And the way to go, I think we'll need to go the contractual way. You know, once somebody is on contract, you can't release him to go to school. We can promise we can do contracts for 3 years, and then after that, we can see whether we can take them P&P, or they can decide where to go. And we found that those who are on contracts are more proactive than those ones who are on P&P, because P&P on Najua, they will run to their unions. So it's a bit difficult to handle them. And actually, I think this will be the way to go in future all over. Like other advanced countries like the US, in Europe, you work on contract. You sign a contract for 5 years. If they'll renew for you, well and good. If no, you look for a job elsewhere, for another contract. And this is what we had proposed. This is the way to go in future. You mentioned about doctors working in private clinics, doing locums. It boils down to supervision, because there should be a duty rota for every doctor. And the hospital needs to be covered 24 hours. There is no excuse. And there is something called landing over. When this doctor leaves, he doesn't leave until the one who is coming to take off from him comes and signs in. We might be forced even to do the logging in hospitals. Yes. We might go that way, although it's not so friendly, but we might be forced to do that. And about the specialists, there are guidelines on how they need to work. But nobody is following the guidelines. And I have it with me. There are the number of ward rounds that they should do per week. There are the number of surgery cases that they should do in a week. And they should cover the hospital whenever there is an emergency. It doesn't matter where you are. That is the policy. That is the policy before devolution. And we are still adhering to it. That is my take. Chair of Health, about the directorates, as I've told you, we have to do an organogram, a rational one, because we don't want to have officers who are sitting in offices without doing anything. There are some programs even you can merge into one, 2 programs into one, and it can be taken care of by one officer. As the chairman of health, something like reproductive health and sexual-based violence can be taken care of by one person. The person who has studied child health can still take care of clinical officers and child health at the same time. We can do rationalization, and I think that will require a maximum of 3 months. And that thing will have been sorted out. Okay, thank you.
Thank you, Dr. for your time. We'll give you 3 minutes to do a wrap-up. But before that, whenever you go to any hospital, be it a private hospital or a public hospital, at the entrance you will find a board written doctor on duty, nurse on duty, officer or specialist on call. For a long time I didn't ask myself what was the role of those things until I participated in a case of medical negligence before the board. And I realized that those things have a meaning. However, in Baringo County, we seem not to understand the meaning of those things because we have lost so many patients through negligence. Yet, when you come to the hospital, you'll find there is a medical officer on duty. Yet, when there's an emergency, the medical officer cannot be available. The specialist on call is not available. Yet, we expect that if you are on call, you are supposed to stop everything else and be within the facility of the hospital. If not possible, the hospital to provide a house for these officers who are on call or on duty, so that whenever they are called, they should be available within 2 or 5 minutes. There's something about in the medical field, in terms of response time, that if you are on call, you should be available within a certain duration. I would want to call upon you, you are a new broom coming to Baringo County. Kindly enforce the standards. As you have said, there are standards for specialists, there are standards expected of a medical officer, there are standards expected of a clinical officer, standards expected of a nurse, and of all medical workers, so that we don't lose patients due to negligence. Because in the near future, a lot of litigation will be on medical negligence. And we don't want the county to lose money because of medical negligence caused by an officer. And the only way we can prevent that is if you, as the new broom, ensure that our officers, our health workers are there to do what's required of them. That's a challenge to you. Secondly, when Honorable Lau asks you whether you can teach these members, you know, each and every day is a learning experience. I expect you, before you leave, tell these members that I also know Chinese, I also know Italian. Tell them ciao and adios. And a few other Italian words, so that you can be able to influence them. One day or two, they learn a new word, because every day is a learning experience. In making your closing remarks, you can tell us one or two words so that they can, you will give them something new to take home.